Welcome to day 4 wrap up here at ESC in Madrid. I'm joined by one of our hosts, Professor Anguita from Cordoba, Spain. He and I are very, very good friends. Actually, it started because of the twinning relationship between Florida and the Spanish Society of Cardiology. We were both leaders of our organization at that time. Dr. Anguita, you're a master of heart failure, and I know that there have been some tremendous heart failure trials that have been presented here. Tell me a little bit about some of the science that really got you excited about being here.
Thank you, Fred. It's truly a pleasure for me to be here with you, a very good friend for a
Yes.
long time ago, and from the ACC is a pleasure, a real pleasure for me. In this Congress of the European Society of Cardiology have been presented several trials,
Mm-hmm.
several important trials about heart failure. Uh, in my opinion, there have been three important trials which
Hmm.
may change the clinical practice.
Okay.
The DIGIT HF trial with digitoxin, the DAPA ACT HF
Hmm.
TIMI68 trial with dapagliflozin, and the Victor trial with vericiguat. Today, in one of the hotlines have been presented the
Uh-huh.
parachute trial that compares sacubitril valsartan and ARNI with enalapril in patients with dilated cardiomyopathy of Chagastic
Sure.
origin.
Okay.
Beginning with this last study, sacubitril valsartan is expected showed superior to enalapril,
Right.
supporting the previous results of the paradigm of the pivotal paradigm trial with sacubitril valsartan in the small subgroup of patients with Chagastic
Yes.
disease. Talking about the DIGIT-HF, this study analyzed the impact of digitoxin, not of digoxin, digitoxin,
Yes.
in patients with heart failure and reduced left
Mm-hmm.
ventricular ejection fraction. And the results, curiously,
Hmm.
were positive.
Wow.
Digitoxin decreased by 18% in
Okay.
a significant reduction of the composite endpoint of cardiovascular mortality and hospital admissions due to the heart failure decompensations.
Hmm.
These results probably should lead to the cardiologist community to reconsider the role of the digitalis
Yeah.
in patients with this disease.
Hmm.
The problem is that the digitoxin is not available currently in the United States,
Right.
nor in Spain or
Okay.
in other countries, but we don't know if the results of the digitoxin trial maybe can
Mm-hmm.
be extrapolable to digoxin.
Okay.
The DAPA ICT is a small studies
Mm-hmm.
with only 2 months of follow-up and showed that adding dapagliflozin to the standard therapy of patients during the admissions
Uh-huh.
for an episode of acute heart failure in this short follow-up period lead to a not demonstration of positive effects.
Mm-hmm.
But dapagliflozin was safe and show a trend to a reduction of events. Probably
Okay.
if the follow-up was longer, 3 or 6 months, the results have
Uh-huh.
been positive. And finally, the Victor trial. The Victor trials compared the vericiguat versus placebo in the patients with heart failure and reduced left ventricular ejection fraction, and the results had been not similar to that of the previous Victoria
Uh-huh.
trial with vericiguat, in which patients have more severe heart failure with a recent hospitalization. In Victor was chronic
I see. Sure.
patients had chronic stable heart failure, and the results did not reach the statistical significance, although overall mortality was significantly reduced, but this was a secondary endpoint.
So tell me a little bit specifically about what you would do so that we had all this noise going
Uh,
on here, but what would you do to take home with clinical practice? So with digitoxin, are you going to start using digoxin on your patients with heart failure?
yeah, I
No.
think we should reconsider an increasing role of digitalis in heart failure with decrease, with reduced ejection fraction and sinus rhythm.
And how about Versaguat?
Yeah.
When do you use that? Are you using it a lot here in Spain, or?
No, the digitalis in Spain has a very little role according to the guidelines
Yeah.
of the European Society of Cardiology.
And how about Versaguat?
Only in patients to control to rate control
Right.
in patients with atrial fibrillation.
Right. But how about for the other trial? So for Victorian, has that changed how you take care of heart failure?
No,
Okay.
no.
All right.
I think the role of Berisiguat currently is the recommendation class is 2B,
Right.
and I don't know that next guidelines
Are going to change it much.
this indication.
All right. Well, Manuel, thank you so much.
Thank
It is so good, and thank you for
Yeah.
hosting such a
Oh.
wonderful conference.
It's a pleasure for us to receive you in Spain, in Madrid.
Beautiful. Thank you so much.
Thank you.
Take care now, all.